Okay, continuing on from the week 12 part 1 lecture. We're up to damage to D, so we'll be focusing on the damage to E and F in this YouTube video. Let me just change that. So E is the upper lower motor neuron, specifically soma of the or cell body of the lower motor neuron. If you recall the basic anatomy of the spinal cord, the soma and or the cell body of the lower motor neuron can be found in the ventral horn of the spinal cord. So damage to E means damage to ventral horn cells or anterior horn cells. And in the movement disorder seminar, the topic that involved damage to anterior horn cell or the soma of the lower motor neurons were the poliomyelitis or post-polio syndrome or spinal muscular atrophies. So let's write those down here. So damage to E, the disorder covered was the poliomyelitis, post-polio syndrome, and spinal muscular atrophies. And the signs and symptoms of this disease is characterized by paralysis, but this case is not involving the hypertonia. It's flaccid paralysis. So you can write here flaccid paralysis. As opposed to spastic paralysis, which is often seen in the upper motor neuron lesion, so damage to D. So damage to D, spastic paralysis. Whereas the lower motor neuron lesion is characterized by flaccid paralysis. So the patients have weakness in the muscle or have no control over the voluntary motion of the muscle. And the wasting of the muscle bulk can happen, so atrophy of the muscle, because the muscle no longer gets the signal from the lower motor neuron. Whereas for upper motor neuron, lower motor neuron and muscles, the connection between two is intact. It's just the descending tracts are damaged, so they don't really get to receive the command from the upper center. So their muscles tend to show the hypertonia, which means the muscle wasting will not really occur. Maybe occur due to disuse, but normally maintains the integrity, the muscle bulk or size of the muscle. Whereas for the patients who suffer from the lower motor neuron disorders, also shows the muscle atrophy. Damage to F. Let's have a look at damage to F. And damage to F is specifically related to neuromuscular junction. Muscular junction, the sinus between the lower motor neuron and the muscle. And the movement disorder that covered the diseases or disorders in the neuromuscular junctions were myasthenia gravis, Lambert-Eaton syndrome, so myasthenic syndrome, Lambert-Eaton syndrome, botulism. So these were the diseases that was related to dysfunctions in the process of the synapse between lower motor neuron and the muscle. And also there were some topics that involved the synapse between the lower motor neuron and interneurons, and it was mainly inhibitory interneurons. So some of the synapse, if there's a damage to the synapse between the interneuron and the lower motor neuron, the example was tetanus or stiff person syndrome. And we can also indicate damage to the axon of the lower motor neuron. So if you have damage to the axon of the lower motor neuron, it's the peripheral nerve damage. And the topic that covered the peripheral nerve damage were the radiculopathies, so for example, carpal tunnel syndrome, sciatica, tarsal tunnel syndrome, and so forth, or Guillain-Barré syndrome. Guillain-Barré syndrome. Which is the demyelination of the peripheral nerves. Diabetic polyneuropathies. So these were the topics related to peripheral nerve damage. And we can also write somewhere here about the damage to the axons in the CNS. The myelinated axons in the CNS, and that's the multiple sclerosis. In other words, multiple sclerosis can occur in any area in the CNS, so it can affect cerebellar function, it can affect the basal ganglia, or it can affect the cerebral cortex or spinal cord. So it really depends on the individual patient's case. So it's the symptoms can vary. Okay, so I guess that's showing the overview of the diseases related to lower motor neurons, peripheral nerves, and also axons and CNS in general. So when you go over the handouts of each disorder, try to make link the association with using this picture, whereabouts this is occurring, and link that back to the pathology of each disorder and also signs and symptoms of that disorder. Lastly, I'm going to finish off with just recapping the 3 learning mechanisms of the brain, and also associate that with the exam preparation tips. So as we covered, so first in week 10 we covered cerebellar learning, and it was characterized by trial and error learning. So let's just write here trial and error learning. This is also known as supervised learning. Where the teacher here or supervisor is the mistake or error. So this learning is you learn from mistakes and go closer to the goal by closing the gap or making the error smaller. And by making the how does the cerebellum making the error smaller was by the calming fibers detecting the error and depressing the synapse between the Purkinje cell and Moser fiber, the parallel fibers, by long-term depression. So long-term depression allows to suppress the error-causing movement and let the other options to try it out, and it gets selected when it achieves the goal. So this is the cerebellar learning, and when we apply this to exam preparation, so let's just apply that to exam preparation. First thing is you have to make mistakes to learn from it. So mistake, how we make mistakes in learning, by solving questions. So in order to find mistakes, you got to test yourself. So do the practice questions. Or if you are doing the group studies, you can ask each other the questions, and by doing that you can test each other. So test each other. And find out what you don't know, or what's the error in your understanding, and so forth. You can also make flashcards. And use that to test yourself. I heard there's some apps available to create flashcards with your smartphones. So maybe you can write some questions in the flashcards and just revise it over and over again. And with reading textbooks, after reading textbooks for like 10 minutes or 20 minutes, you can close the book and try to recall as much as possible. So it's like a mini retention test after reading the content, and write down what you remember and compare that to the texts that you have just read. So these are the tips you can apply to prepare exam, and this is all related to learning from mistakes, which is the learning mechanisms of the cerebellum. In week 11, we covered the basal ganglia learning, and this is characterized by reinforcement learning. It's mainly positive reinforcement, and positive reinforcement comes from the reward. So pleasure. You get pleasure from doing something, and you want to get more pleasure, so you just do more of that reaction or actions, and that creates the strong relationship between the stimulus and response. So in these types of learning, it doesn't really have a goal. What it leads to learning is the reward signal. It's the pleasure signal. So if you get pleasure, so you can predict the pleasure, the dopamine release gets greater, and that facilitates the strengthening the synapse within the basal ganglia circuit. So how are you going to apply it to the exam preparation? First, pleasure from learning. Well, how you get pleasure from learning? It was very stressful. Well, you can actually make pleasure from learning by asking questions. So while reading the textbook, I said to this in my tutorial class, don't read passively, but read actively, which means while you read a textbook, you keep asking questions. What is this term? I don't understand this. So you just write down the questions next to the blank in the textbook, and try to find the answers to those questions. When you find the answers, you might get pleasure, because that means you understood something that you didn't know. So active reading, so like questioning while reading and finding the answers. And also, if you form a group study, this also can have this reinforcement mechanisms, because as a group, you might feel you achieved something after each session, and that might give you a pleasure. And, you might want to do more because it gives a pleasure. Or you can set a goal. So long-term and short-term goals, and goals for each day. And goal setting actually gives the pleasure, because once you achieve the realistic goals for each day, you feel like you achieved something, and that will give the pleasure and keep on track of your learning process. So these tips are related to the reward signal based reinforcement learning in the basal ganglia, and these are the tips that how you can apply this learning type to your exam preparation. And lastly, week 12, we learn about the cerebral cortex learning, which is associative learning. Associative learning. And this was characterized by what gets fired together, wired together. So the neurons that's fired at the same time gets increase in its synaptic signal, synaptic strength, and it will be recalled later together. So if you keep repeating that simultaneous firing of the neurons together, it will facilitate the retrieval of that memory. So more links helps the memory, better memory. So how are you going to use this to exam preparation? So associated with learning type, first, read a lot. So read a lot. The more information you have about the content in different angles, the more association between the neurons will occur. So if you want to recall certain contents, because of the many links associated with that content, your retrieval will be faster and stronger. So you can read different textbooks, you can read blogs related to explaining some contents related to this unit, or you can watch YouTube videos explaining the pathways and so forth. So read a lot and use the resource. The other tip could be use all senses. When you recall some contents, so not only just the verbal facts about this content, so oh, this is ipsilateral, maybe you can use your movement to indicate, oh, like if you touch your head and say, oh, the cerebellum is damaged and my limbs on the same side will be damaged by moving your limbs around, and that's actually facilitating the proprioception and touch sensations, as well as visualizing what happens, the pathway damage. So all senses, use all senses, and also you can link that to everyday life. So while reading textbooks, you can keep thinking about how this is going to be applied to everyday life. Or if you are like feeling something while walking, you step on something sharp and you feel pain, and you can maybe say, oh, my spinothalamic tract is activated. When you got drunk and you feel dizzy, and like, oh, my vestibulocerebellar tract is active at the moment, and the semicircular canal, the hair cells have been flopped by the cupula and so forth. So link that with everyday life. They will actually strengthen the connections of that content, the neurons activated. And use mnemonics. So if you search the term mnemonics, it's the memory techniques, and it all uses this associative learning that happens in the cortex. So some of the tips in the mnemonics is when you want to memorize some semantic contents, so knowledge, you first convert that knowledge into vivid image. vivid image. So using all senses. And second, you make that images to interact with each other. Interact. So actions, put actions in the image. So you can imagine action potentials moving across the axons, or neurotransmitters binding to the receptor. So any movements in the contents, vivid contents. And also lastly, make that image, the interaction, really funny or bizarre. So you can actually create a characters in the image that you've created. So for example, you can think of neurotransmitters as like the little Pac-Mans, and try to cross the synaptic cleft, and the receptors like a gate man, and just what's your password? Are you the right gate? Are you like arriving at the right gate, or so forth? And once it's opened, you can imagine like little tiny man carrying the like sodium ions rushing to the gate or not, and so forth. So you can create a cartoon-like images, and that will actually facilitate your memory, because people tend to remember the bizarre facts or funny images. So this is just small tips related to associative learning using your cerebral cortex. So hopefully you'll use all of those learning mechanisms and put into practice, and get a good marks in your final exam. So that's it for today. Well, that's it for all the 12-week semester. I really enjoyed teaching you guys. Hope I had a more face-to-face lectures with you from week 8 to 12, but I think the YouTube videos was good alternatives. So any questions, use the 1-minute quiz. I'm more than happy to provide you with more of this type of YouTube videos during the study break.